Hello, this is the third presentation in a series of 6 and will describe the second section of SiREN's Sexual Health and Blood-borne Virus Program Planning Toolkit called What Does Your Program Expect to Change? This video will consider the question, what will change as a result of the program? It's important to clearly define what changes are expected to be seen as a result of the program during the early planning stages in order to develop effective strategies that have measurable outcomes that can be evaluated. While it may be tempting to jump ahead and start deciding what strategies to use, taking the time to plan your program and support it with evidence of what will work for your specific target group and setting will ensure that you make the best use of limited resources. In this section of the toolkit and video, you'll learn how to define risk and protective factors, write SMART goals and objectives, link objectives to program strategies, differentiate between short and long-term changes, and identify project planning tools and templates. A risk factor is something that increases a person's chances of developing a disease. For example, being unvaccinated is a risk factor for contracting hepatitis B. Protective factors are the opposite. Protective factors are the reason that some people have better health outcomes than others when faced with the same health issue. For example, social support is a protective factor. We know that people diagnosed with HIV have better health outcomes when they have good social support. When writing your objectives, you may decide to focus them on reducing risk factors or increasing protective factors associated with your health issue. There are 5 main kinds of risk and protective factors: behavioural, biomedical, environmental, genetic, and demographic. Behavioural are individual-level risk factors and are about making lifestyle-related behavioural changes, for example using condoms. Biomedical risk factors are bodily states that can contribute to the development of illness or disease. Environmental are factors in the environments in which people live. This may include social, political factors, or physical or chemical factors. Genetic factors include things that influence your genetic predisposition to a health issue. For example, some women are more susceptible to HPV infection. Genetic factors aren't modifiable. Demographic factors include age and sex, and like genetic factors, are generally not modifiable. Risk factors rarely operate in isolation, so they will often coexist and interact with each other, and may predispose an individual to behave in a certain way, contribute to, or reinforce a health issue. Setting clear and measurable goals and objectives is one of the most important steps in effective program planning and evaluation. The largest failing of program planning is to move directly to creating program strategies without a clear understanding of the issues and what the desired outcome should be. This often results in programs without direction, opportunities and alternatives missed, and outcomes that can't be evaluated. A goal is what you ultimately want to achieve with the program. It can also be called the aim or primary outcome. The goal is always related to the health or social issue that the program is aiming to address. This goal is for a program that aims to address the health issue of sexually transmitted infections. Objectives are the changes that are to be brought about by the target group and correspond to the risk factors that cause the health concern. Objectives generally have a behavioural or environmental focus. In this instance, it's about increasing testing which will reduce the prevalence and spread of sexually transmitted infections, thus contributing towards the achievement of the program goal. The information that you've gathered through your needs assessment helps to inform your goal. Your goal needs to be stated very specifically. It should describe a change in your target group that clearly links to your health issue. Goals are long-term but achievable within the life of the program and will be measured in your outcome evaluation. Objectives relate to the risk factors such as limited sexual health knowledge or a lack of awareness where sexually transmitted infection testing services are located. It should be clear how your objectives will lead to the achievement of the goal. The objective stated here, to increase the number of students who have had a test, clearly links to the example goal given of reducing sexually transmitted infections. In order to write goals and objectives in measurable terms, it's desirable for the statements to reflect the place, person, time, and amount. This is often referred to as writing SMART objectives, which stands for objectives that are specific, measurable, achievable, realistic, and time-specific. Being specific is about clearly stating the who, what, and where. For your goals and objectives to be specific, you need to include them within your setting and target group. Your goals and objectives need to be measurable for when it comes time to evaluate. Therefore, you'll need to put an amount on it. Which brings us to the next point. They need to be achievable within the time frame and with the resourcing available to your program. Make sure you're realistic when setting your goals and objectives. You don't want to underestimate what the program can achieve, but overstretching yourself and not meeting your targets will be demotivating. So take the time to find the right targets for your program. Time is the point by which you expect to see the desired change. This can be expressed as a period after the beginning of the program, such as 6 months from the beginning of the program, or may be expressed in terms of milestones, for example by the year 2020. Careful selection of the terms used to express goals and objectives will provide clear intentions of what you plan to achieve. Clear and direct words are key to setting the commitment of the objective. Words that are clear and specific may include identify, compare, or report. It's recommended to avoid using vague or fuzzy terms such as understand, enjoy, or know. These are less specific and can be difficult to measure when it comes time to evaluate. Often people struggle with putting a measurable amount to their goals and objectives and ask, how much change is enough? To determine this, you could look at past national goals and targets set by governments, how your community compares to national averages, asking colleagues and funding bodies what they consider a reasonable change to be. Look out for natural fluctuations such as what happens in holiday periods. Or looking at what others have achieved. This may include findings presented in reports or journal articles. Remember that each objective should answer who, what, how much, and by when. The goal is what you want to achieve overall and links to the health issue. The objectives are what you expect to change and correspond to the risk factors, including the health problem, and are used to shape the strategies. Your program objectives are used to decide on program strategies. This is the activities that your program will undertake, and it is what you are actually going to do. For example, if your objective was to increase testing for hepatitis B, a strategy may be to set up a mobile testing clinic. There are a wide variety of planning tools that you can use to assist you to describe your health issue and define your goal, objectives, and strategies. The 5 tools listed here are described in the toolkit. Take the time to review them and find one that suits your needs. We hope you now have a good understanding of how to define what it is that your program will change. Don't forget, if you get stuck at any point, SiREN provides strategic planning, evaluation, and research support. So if you need help with applying this toolkit to your work or any other planning, evaluation, or research support, please get in touch via email. The next video in this series discusses the 3rd section of the toolkit, Why Will Your Program Work? This is where you will learn about program theory.